say there's a lot of opposition from doctors community and Patients First and other persons that actually, and organizations that want the status quo to remain. The reality is that we as a government were elected to make some tough decisions, and we recognize that it is imperative that we curtail the spending. Our healthcare costs are unsustainable, $770 million a year. We need to ensure that we have access to healthcare for all and that it's affordable. And as such, through consultation and through a lot of deliberations, beginning first in 2011, and then picking up again in 2018, the government decided that the unified model, and it was announced in August of last year, would be the best for the size of our jurisdiction. It will be sustainable, and it will help to accomplish one of the goals I just spoke about, which was universal health coverage. We've got the fiscal responsibility panel that was first impaneled by the OBA government, and they just published their report. And one of the comments that they said was, healthcare is a vexing issue throughout the world. I'm paraphrasing. However, we commend the Bermuda government for taking steps for a unified system. Though it will be unpopular, forge ahead. And that's exactly what we were elected to do, and that's what we're going to do.
So it's decided. I mean, it's going to happen.
It is. It has been decided. That's correct.
And around the autumn, the time of September, October, is that about the timeline at this point?
I would love to say yes, but we know that this is going to be something that's going to have to be done in phases.
Right.
And it probably will take realistically between 3 and 5 years to be fully implemented. I wish I could wave a magic wand and say, yes, we're going to do it come August, but realistically, it cannot be. We're working on the transition part now. However, just like in Bahamas, they've implemented, and I think theirs has been for a couple of years now, and they've got maybe a half of the population that are already enrolled, but they have to do it in phases. It's not something that will be done overnight. We will continue consulting with the medical community, the insurance community, the business community, unions, because it's something that will affect each and every one of us. So no, it won't happen overnight. It will have to be done in phases. However, as I said, we are satisfied that, notwithstanding the opposition, again, as you said, you yourself said doctors and other organizations, but the reality is that there are persons that have certain vested interest in the status quo remaining. And unfortunately, the status quo is not working for a majority of people. Mm-hmm. And 20% of our population are either underinsured or uninsured. So clearly the status quo is not working for them. As I've indicated previously, the likely provider of the unified system, it will be an RFP, an open and transparent system, and allow for companies, to bid on it and for them to actually be the provider of the unified system.
Okay, so it'd be one health insurance company locally?
That's the intent, of course, is that it would be a local company that would do it. However, again, it'll be an open, transparent process. Right. Insurance companies will be able to bid as to who will be the provider, but it will be, like you say, one provider.